Hello, my name is Sue Lyon. I've been a kidney patient for over 40 years after being diagnosed at Guy's and St Thomas's when I was 25. Hi Lorna.
Good afternoon, Sue.
I was treated with home haemodialysis and then I was fortunate enough to have a deceased donor kidney transplant 32 years ago, and I'm pleased to say it's still going well. The team at Guy's have asked me to introduce this series of 4 films.
Oh, lovely.
Each film focuses on a particular aspect of the kidney journey, starting with diagnosis. The films feature clinicians talking about various aspects of chronic kidney disease, including treatment choices. The films also feature patient stories, and we hope by listening to these stories you'll feel empowered to become involved in your care and work in partnership with your team.
Chronic kidney disease, or CKD, means your kidneys are not working properly. Chronic doesn't necessarily mean serious, it means it's been going on for a long time and will go on for the rest of your life. However, most people with CKD do not develop kidney failure, and most people will live the rest of their life with mild CKD and no symptoms of it. If you have mild chronic kidney disease, it's important to reduce the chances of the kidney disease getting worse by adopting a healthy lifestyle. And this may involve all or some of what we call the Big 6. This means eating healthily, taking regular exercise, and giving up smoking. You should also reduce your alcohol intake. It's important to keep your blood pressure down. Now, some lifestyle factors can help with this, but most people will need to take tablets. If you're diabetic, it's important to keep your diabetes under control. With chronic kidney disease, like any chronic condition, it's important to work in partnership with your healthcare team. Therefore, you should attend any appointments with your kidney clinic or with your GP, and it's essential that you take any medications that are prescribed to you. So Glenn, we've known each other for some time now. How long is that again?
It's just over 8 years.
You must be quite nervous when we first met.
Yeah, it was a really scary time. You get this diagnosis, you don't really know what's going on, and it's scary. It is scary.
And with chronic kidney disease, we think it's very important to establish a kind of partnership between the healthcare people and the patient, so that you can feel comfortable to manage your own condition as well as seek advice. So what sorts of things did you do to try and improve your situation?
Stop smoking. Well, I cut down at first, then I stopped. I watched how much I was drinking, because I do like a drink. Healthy eating and taking exercise. I started doing boot camps, I'm not sure if you remember, in St James's Park, a couple of times a week. Obviously taking my medication when prescribed. I don't think I've ever missed a day of my medication because it's structurally built into my day.
Most people with chronic kidney disease don't have a progressive form of that condition, but unfortunately you do and did. One can make a prediction on blood tests to see how long your kidneys are likely to survive and you not needing dialysis or a transplant. And when we first met, we predicted that might be about 4 to 5 years, something like that. But I think you've described a lot of changes that you've made to slow down that process.
Yes.
So how did that go?
Well, it worked. I'm here 8 years later, so it's almost double than was initially thought or forecast. And I think the thing is, it's down to working with you guys, obviously, but also the changes I've made myself.
So that really illustrates nicely what we're trying to achieve in the kidney clinic for people with the progressive form of kidney disease, which is to slow down that process for as long as possible by working in partnership with our patients.
With you guys.
Thank you very much.
If your kidney disease does progress, you'll need to think about treatment, either dialysis or transplantation, and these topics are covered in the next 2 films.